Today we are going to talk about how to initiate an OSCE station. Be sure that you are standing at the right station. Read the scenario carefully, domains being tested, and your task for that station. Write down the name of the patient, age, weeks of gestation, any comorbidities, abnormal test results, ultrasound findings, what has been done so far, and location of patient. You can check clinical information with patient, but if you forget the task been tested, it will be a disaster as nobody will correct and guide you. If you could not finish reading the information, then you can stay longer, but time will be deducted from your 10 minutes. Make a mental or written plan for that particular scenario. Prepare and compose yourself before entering the cubicle. On hearing the buzzer, enter the station as you will go to the clinic or wards confidently. Slowly, with a pleasant facial expression, make eye contact with the patient. Say, "Hi, I am Dr. So-and-so covering OB/GYN clinic today. You are Mrs. A and you have just turned 40. I understand that you are here today for," in this case, if information has been given in the scenario, then you will say that at this point. Confirm the purpose of consultation. Or you can say, "How can I help you today?" Give patient an opportunity to tell her story. Lean forward. Listen carefully without interrupting her. Encourage her. Say words like, "Okay, yes, all right, I see, perfect." Show appropriate facial expressions also. Maintain eye contact. Show to patient that you are interested and concerned about what she is sharing with you. Don't even look towards the examiner or lay examiner, as you are supposed to focus on your patient. When patient finishes her statement, you should acknowledge her emotions and say, "I'm sorry that you have been feeling this way," or "I'm sorry that you had a hard time getting through it," or "I'm sorry for your loss." If patient is happy about her condition, you should also say something like, "Congratulations," if she has conceived after a long period of infertility. You should summarize whatever she has just told you, as you can plan what you will do next. Before moving on, you should ask her, "Is there anything else that you were hoping to discuss today?" You have to look for some hidden agenda here, as in case of domestic violence or fear of getting some cancers. Patient may present with non-specific complaints. Then, once you are sure what the patient has told you, you should set an agenda as an important part of initiating the station. Signpost to the patient that you need to ask them certain specific questions which she may find a bit intruding, but they are helpful in assessing her condition. Gathering information. You should gather information from patient to explore the issues as well as to register her perspective. As you have listened to her initial complaints, now you should ask some open-ended questions like, "Can you please tell me a bit more about the pain you have been feeling?" Now ask some closed questions like, "So, you experience pain during your periods also?" Use closed questions if there are gaps in our history. Ask about all of her symptoms to determine if they are just part of current complaint or due to some previous condition. To determine the patient's perspective, ARIZ model has been validated. Ideas. Do you have some idea what might be causing your symptoms? C. Concerns. Is there anything in particular that has been worrying you about your condition? E. Expectations. What were you hoping us to do for you today? Feelings and effects. How have you been feeling about your condition? How has it affected your life? It is impossible to take a detailed history due to time constraint, but you need to say, any health issues in the past? Or, do you see your GP for any problems? Or, are you generally fit and well? Any operations? Obstetric history. Say, so you have 2 babies. Delivered normal? No problems with afterbirth? Do you remember their birth weights? If no information given about the scenario outside the station. Gynecological history. Are your smears up to date? Contraception. Medications and allergies. Very important patient safety issue. Ask all the patients about them. Family history, especially hypertension, diabetes, heart diseases, and cancers. Social history. Do you feel good at home? What do you do for living? Do you have support at home? Do you smoke? If she says yes, ask, is it regular smoking? How many cigarettes per day? Have you ever thought about quitting? If you like, I can give you numbers to NHS smoking cessation program, as they can help you. If she says, I don't want to stop smoking, say, okay, but if you change your mind later, please contact back. Do you do any drugs? Do you like to exercise? Do you eat healthy diet? Then establish a relationship. Active listening means that you are understanding what patient is telling you. You should talk slowly, clearly, calmly, and in a friendly way. Your tone should be consistent, but if patient is depressed due to conditions like an IUFD, newly diagnosed cancer, or is upset about her condition, you should lower your tone further. Role players will express their perspective through their emotions. It is very important to pick up cues, recognize and acknowledge them. For example, say, "It must be very difficult for you to go on while you have been feeling this way." Summarize again to let the patient know that you have been listening to her and you are following the timeline accurately. Signpost alerts your patients for next part of consultation and you are not trying to catch them off guard. Focus should be on empathy throughout the entire station. Then explain the condition and plan her management. Give appropriate information to the patient in simple words. Ensure that she has understood you. Ask her about how much she knows about her clinical condition, diagnosis, and expected recovery. For example, you can say, "What do you know about the name of her problem? Do you like me to give you just basic information or explain it in detail?" Give information in clear and simple words without using medical jargon, in bits, and ensure that she has understood fully. Are you with me so far? Inform patient about all management options, including no treatment. Describe your management plan. Tell her about intended benefits. Then tell her about the risks and the consequences if nothing done for her. Also talk about alternative treatments, pre and post intervention information, and safeguarding. After this, come to how to close consultation session. Say, "So miss, you are a diabetic and seeking information about starting your family." Then summarize the most important points in her history. Be sure to include her wishes in the management plan. Agree on the next step, how to achieve it. Who is her doctor? Ensure patient safety, like what to do if a situation emerges on off hours, where to go and what to do. Then close by checking if she is happy with the chosen plan. Then in the end say, "Thank you for coming to the clinic today." I will document everything in your record. Have a nice day.